Your blood type is not just a letter on a medical form. It is not just something hospitals need during an emergency. It is not just something you learned once, forgot, and never thought about again. Your blood type may be one of the most overlooked clues inside your body after 45. Because that one letter, O, A, B, or AB, may give clues about how your blood clots, how your blood vessels behave, how your stomach responds to certain infections, how your heart risk may change, and even how your brain may need protection as you age. Now, I want to be very clear from the beginning. Your blood type is not your destiny. This is not a horoscope. This is not fortune-telling. This does not mean one blood type is good and another blood type is bad. It does not mean you are doomed. It does not mean you are safe. It means your blood type can be a biological clue. And after 45, clues matter, because this is the age when silent risk starts becoming visible. Blood pressure starts creeping up. Cholesterol becomes harder to ignore. Blood sugar may start moving in the wrong direction. Stress affects the body more deeply. Sleep becomes lighter. Inflammation lasts longer. Memory changes begin quietly. Digestion becomes more sensitive. And the habits you ignored in your 30s can start sending bills in your 50s, 60s, and 70s. I am Dr. Adrian, and today I am going to explain what your blood type may be warning you about after 45. Type O, Type A, Type B, Type AB. And then I will explain the plus or minus sign, the RH factor, that most people completely ignore. But stay with me until the end, because there is one factor stronger than your blood type. It is the factor that decides whether your blood type becomes a serious warning or simply useful information. Once you understand that factor, you will never look at your blood type the same way again. Before we begin, think about your blood type right now. Are you O positive, O negative, A positive, A negative, B positive, B negative, AB positive, AB negative? If you do not know, this video may be the reason you finally find out. Because knowing your complete blood type is basic health information. It matters for blood transfusions. It matters for surgery. It matters for pregnancy. It matters in emergencies. And based on research, it may also help you understand certain health patterns more personally. So let us start with type O. Type O is often called the oldest or original blood type. Many people with type O hear that and think they are naturally protected. And in one important way, type O does have an advantage. People with type O tend to have lower levels of a clotting-related protein called von Willebrand factor. This matters because von Willebrand factor helps blood clot. Lower levels can mean that type O blood may be less prone to certain clot-related problems compared with non-O blood types. This may be one reason why studies have found that people with type O blood have a lower risk of coronary heart disease compared with people who have AB or AB blood. That sounds like great news, but every biological advantage can have a shadow. If your blood clots less aggressively, that may reduce certain clot risks, but it may also mean bleeding deserves attention in some situations. This does not mean every type O person bleeds dangerously. It does not mean you should panic. But if you are type O and you bruise easily, have frequent nosebleeds, bleed heavily after dental work, bleed more than expected after surgery, or take blood thinners, aspirin, or frequent anti-inflammatory painkillers, you should make sure your doctor knows. Not because type O is dangerous, because details matter. In medicine, the small detail you forget to mention can become important when you are having surgery, dental work, a colonoscopy, or emergency care. Now, type O also has another area that deserves special attention: your stomach. Some research has linked type O blood with increased susceptibility to Helicobacter pylori, often called H. pylori. H. pylori is a bacteria that can live in the stomach lining. It is one of the major causes of chronic gastritis and stomach ulcers. In some cases, long-term untreated infection is also linked with increased stomach cancer risk. The problem is that H. pylori can be quiet. It does not always announce itself. It may cause burning pain, bloating, nausea, bad breath, indigestion, early fullness, stomach discomfort, or it may cause almost nothing for years. So if you are type O and you have persistent stomach symptoms, ulcer history, unexplained iron deficiency, repeated indigestion, or burning stomach pain, ask your doctor whether H. pylori testing makes sense. It can often be checked with a breath test, stool antigen test, or other medical testing depending on your case. Do not randomly take antibiotics. Do not live on antacids for years without asking why your stomach keeps burning. Do not ignore repeated stomach warning signs. Your type O safety loop is simple. Protect your gut. Be careful with frequent NSAID use like ibuprofen or naproxen unless your doctor says it is safe. Practice food safety, especially when traveling. Do not ignore ulcer-like symptoms. Ask about H. pylori if symptoms fit. And keep moving, because a lower statistical risk of heart disease is not the same as immunity. A type O person who smokes, sits all day, eats processed food, ignores blood pressure, sleeps badly, and never exercises can still develop heart disease. Blood type does not cancel lifestyle. Non-O blood types tend to have higher levels of von Willebrand factor and factor VIII. In plain English, clotting biology may be more active. This is one reason research has found that AB and AB blood groups have higher coronary heart disease risk compared with type O. Now, if you are type A, do not hear this and panic. This does not mean you are going to have a heart attack. It does not mean your blood is bad. It means your heart and blood vessels deserve serious attention, especially after 45. Because after 45, most people are not dealing with one risk. They are dealing with layers. Blood type is one layer, high blood pressure is another, high cholesterol is another, blood sugar is another, belly fat is another, smoking is another, poor sleep is another, chronic stress is another, sitting all day is another. And when several layers stack on top of each other, that is when risk becomes more serious. Type A is where stress becomes a major part of the conversation. Many type A people live in a constant state of mental pressure. They push hard. They overthink. They carry responsibility. They answer messages late at night. They sleep less than they should. They sit for long hours. They call stress normal because they have lived with it for so long. But the body does not call it normal. The body reads chronic stress as a signal. Stress can raise blood pressure. It can worsen sleep. It can increase cravings. It can disturb blood sugar. It can increase inflammation. It can make people move less and depend on caffeine more. And if your clotting-related biology is already more active, then protecting your blood vessels becomes even more important. If you are type A, stress management is not a luxury. It is not just a wellness hobby. It is part of your cardiovascular protection plan, and it does not have to be complicated. 5 minutes of slow breathing every morning, a daily walk, 10 minutes without your phone, going to bed at the same time, strength training twice a week if your body allows, checking blood pressure at home, eating more fiber, reducing processed meats, reducing sodium, reducing sugar, standing up during long sitting. These sound simple, but simple repeated daily becomes powerful. Now here is something type A viewers may want to discuss with a doctor. Homocysteine. Homocysteine is an amino acid in the blood. When it is elevated, it may be associated with blood vessel risk. Not everyone needs this test, and it is not a magic marker. But if you have family history of heart disease, early cardiovascular disease, stroke risk, or unexplained vascular issues, it may be worth asking your doctor whether homocysteine testing fits your situation. Folate, vitamin B12, and vitamin B6 help the body process homocysteine. You can get these nutrients from foods like leafy greens, eggs, fish, poultry, legumes, and fortified foods depending on your diet. But do not blindly take high-dose supplements without testing and medical guidance. More is not always better. Precision is better. Your type A safety loop is this. Move your blood. Calm your stress. Check your pressure. Know your cholesterol. Know your blood sugar. Do not sit for hours without moving. Do not let stress become your identity. And do not wait for chest pain before you care about your heart. Cardiovascular disease often builds quietly. The first symptom should not be the first warning. If you are type A, remember this. Your biggest protection is not fear. It is daily vascular care. Walk, breathe, sleep, test, monitor, eat for your arteries. Your blood type may be a clue, but your habits write the next chapter. Now let us move to type B. Type B is often described online in strange ways. Some people turn it into a personality type. Some say type B should eat only certain foods. Some make claims that sound more like mythology than medicine. We are not doing that here. We are going to stay practical. For type B, I want you to focus on metabolic stability and inflammation awareness. Why? Because after 45, inflammation and metabolic dysfunction are connected to almost every major chronic disease. Heart disease, diabetes, kidney disease, fatty liver, joint pain, brain fog, poor recovery, low energy. And in real life, the biggest triggers are often not mysterious. Ultra-processed foods, refined sugar, poor sleep, long sitting, excess belly fat, smoking, heavy alcohol, low fiber, chronic stress, too little movement. Now, some people with type B may notice they feel worse after certain foods. Heavily processed wheat products, sugary snacks, fried foods, fast food, ultra-processed meals. They may feel bloated, tired, inflamed, foggy, stiff. But instead of becoming afraid of food, I want you to become observant. Track your body. For 2 weeks, write down what you eat and how you feel. Energy, digestion, sleep, joint stiffness, mood, skin, cravings, mental clarity. Then look for patterns. If something repeatedly makes you feel worse, reduce it and see what changes. Do not guess forever. Collect clues. If you are worried about inflammation, ask your doctor about C-reactive protein, also called CRP. CRP is a general inflammation marker. It does not diagnose everything. It does not tell the whole story. But in the right context, it can help your doctor understand whether inflammation may be running higher than expected. For type B, the safety loop is this. Reduce ultra-processed foods aggressively. Eat variety. Support the gut. Move consistently. Avoid extreme workouts without recovery. Focus on moderate movement you can repeat. Walking, cycling, swimming. Swimming, hiking, light strength training, mobility work. Your goal is not to punish the body. Your goal is to regulate it. Now, if you are type B and you have ongoing fatigue, joint stiffness, unexplained digestive problems, thyroid symptoms, persistent skin issues, numbness, cold hands and feet, or inflammation that does not make sense, do not just say, "I am getting older." Get evaluated, ask questions, check blood sugar, check thyroid if symptoms fit, check vitamin D if appropriate, check inflammatory markers if your doctor agrees, check kidney and liver markers. Vague symptoms are not always normal aging. Sometimes they are lifestyle, sometimes they are stress, sometimes they are inflammation, sometimes they are a medical condition. The worst thing you can do is dismiss everything until the problem becomes louder. If you are type B, remember this. Your goal is balance, food variety, low processed food, inflammation awareness, moderate movement, good sleep, and careful listening to your body's patterns. Now let us move to type AB. Type AB is the rarest of the four main ABO blood groups. It carries both A and B antigens. Because it is rare, people often talk about it dramatically. They call it mysterious. They call it complex. They call it the most unusual blood type. But let us focus on what actually matters. One of the most attention-grabbing findings in blood type research is that type AB has been associated with higher risk of cognitive impairment in some studies. One study reported that people with AB blood were more likely to develop thinking and memory problems compared with other blood types. Now, listen carefully. This does not mean every AB person will develop dementia. It does not mean your brain is doomed. It does not mean you should be afraid of your blood type. It means if you are AB, you should take brain and blood vessel health seriously, because your brain is a blood flow organ. It needs healthy circulation. Tiny vessels feed the brain. Tiny vessels support memory. Tiny vessels help your thinking stay sharp. And what damages those vessels? High blood pressure, high blood sugar, high cholesterol, smoking, poor sleep, inflammation, long sitting, obesity, heavy alcohol, stress. So for type AB, the brain plan and the heart plan are almost the same plan. Protect blood vessels and you protect the brain. Control blood pressure, control blood sugar, know your cholesterol, move regularly, do not smoke, limit alcohol. Eat for vascular health. Sleep enough. Keep learning. Stay socially connected. Do not ignore memory changes. Sleep is especially important here. During deep sleep, the brain performs important cleanup processes. Poor sleep can affect memory, mood, blood pressure, appetite, inflammation, and long-term brain health. If you are type AB and you regularly sleep less than 6 hours, snore loudly, wake up gasping, or feel exhausted during the day, ask your doctor about sleep apnea. Sleep apnea can raise blood pressure and reduce oxygen levels at night. That is not just a sleep problem. It is a brain, heart, and vascular problem. Now, type AB viewers should also take cognitive challenge seriously. Not passive scrolling, not watching random videos for hours. Real challenge. Learning a new language, playing a musical instrument, studying something difficult, reading complex material, writing, solving problems, taking a course, learning a skill that forces the brain to adapt. This builds cognitive reserve. Cognitive reserve means your brain has more backup pathways, more flexibility, more resilience, and as we age, that reserve matters. Your type AB safety loop is this. Treat cardiovascular health as brain health. Sleep like it is medicine. Move like your memory depends on it. Eat for blood vessels. Challenge your mind. Know your blood pressure. Know your blood sugar. Know your cholesterol. And if memory changes start affecting daily life, get evaluated early. There may be treatable causes, medication side effects, sleep apnea, depression, vitamin deficiencies, thyroid problems, hearing loss, poor blood sugar control. Do not jump straight to fear, but do not ignore it either. If you are type AB, remember this. Risk is not destiny. Your brain has a protection plan. And the earlier you start, the more power you have. Now let us talk about the Rh factor, the plus or minus sign after your blood type. O positive, O negative, A positive, A negative, B positive, B negative, AB positive, AB negative. Most people know the letter, but many forget the plus or minus. Do not ignore it. The Rh factor is especially important for blood transfusions and pregnancy. If you are Rh negative, your red blood cells do not have the Rhd antigen. That matters if you receive blood. It matters if you are pregnant. It matters in emergency care. For transfusions, compatibility matters. Hospitals check blood type carefully because incompatible blood can cause dangerous reactions. If you have a rare blood type, especially AB negative, B negative, or O negative, knowing your type matters even more. In emergencies, every minute matters. If you know you have a rare blood type, consider storing that information in your medical ID, phone health app, wallet card, or emergency record. Now, for pregnancy, Rh negative status is extremely important. If an Rh-negative mother carries an Rh-positive baby, the mother's immune system can sometimes form antibodies against Rh-positive blood cells. This can create serious problems for the baby, especially in future pregnancies. Modern medicine can prevent many of these problems with Rh immune globulin, often known as anti-D or RhoGAM depending on the country. This is standard medical care. If you or someone you care about is Rh negative and pregnant or planning pregnancy, make sure the doctor knows. This is not something to guess about. It needs medical supervision. Now, some online videos make Rh negative sound supernatural or mysterious. Ignore that. Rh factor is not magic. It is immunology. Its strongest everyday medical importance is transfusion compatibility and pregnancy care. Now we have covered type O, type A, type B, type AB, and Rh factor. But here is the most important part of the whole video. Your blood type is a clue. It is not a sentence. Genes may load the risk. Habits often pull the trigger. I have seen people with higher statistical risk live strong, healthy lives because they controlled the basics. They walked daily, they controlled blood pressure, they did not smoke, they slept well, they controlled blood sugar, they ate real food, they asked for the right lab tests, they treated symptoms early. And I have seen people with a lower risk profile damage their health because they assumed they were naturally protected. They ignored blood pressure. They lived on processed food, they smoked, they slept poorly, they sat all day, they avoided doctors, they treated their body like it would never ask for payment. Your blood type may tell you where to look, but your habits decide what happens next. So let us summarize clearly. If you are type O, you may have a lower clot-related cardiovascular risk compared with non-O types, but your gut and bleeding tendencies deserve attention. Your protocol is gut protection, movement, food safety, not ignoring ulcer-like symptoms, and telling your doctor if bleeding seems unusual. If you are type A, your blood belongs to the non-O group that may carry higher clotting-related cardiovascular risk. Your protocol is blood pressure monitoring, cholesterol control, stress reduction, movement, sleep protection, and asking about homocysteine if your doctor thinks it fits. If you are type B, your practical focus is metabolic stability and inflammation awareness. Your protocol is processed food reduction, food variety, moderate exercise, gut support, sleep, and tracking symptoms instead of dismissing them as age. If you are type AB, your focus is brain and blood vessel protection. Your protocol is blood pressure control, blood sugar control, cholesterol management, omega-3 rich foods if appropriate, sleep, mental challenge, and early evaluation of memory changes. If you are Rh negative, make sure your healthcare team knows, especially for pregnancy, transfusions, surgery, and emergencies. Now, what should you do tomorrow? First, find out your complete blood type if you do not know it. Not just O or A. Know the plus or minus. Second, write down your top 3 risk areas. If you are type O, gut and bleeding awareness. If you are type A, heart and stress awareness. If you are type B, inflammation and metabolic awareness. If you are type AB, brain and vascular awareness. Third, check your basic health numbers. Blood pressure, cholesterol, blood sugar, weight or waist size, sleep quality, family history. These numbers matter more than guessing. Fourth, choose one safety habit, not 10. 1. A daily walk, a blood pressure log, a doctor visit for stomach symptoms, less processed food, better sleep, 5 minutes of slow breathing, a cholesterol test, a blood sugar test, a conversation with your physician. Fifth, stop using blood type as an excuse. Do not say, I am type A, so I am doomed. Do not say, I am type O, so I am safe. Do not say, I am type AB, so memory loss is coming. No, say this instead. Now I know where to pay attention. That is the correct mindset. Now let me tell you a story. Imagine 2 men. Both are 52. Both have type A blood. Both have a family history of heart disease. Both work stressful jobs. Both have slightly high blood pressure. The first man says, it is genetics. What can I do? He keeps sitting all day. He eats processed food. He sleeps 5 hours. He checks blood pressure only once a year. He uses stress as an identity. He says, this is just who I am. The second man hears the same information and responds differently. He says, if my cardiovascular risk may be higher, I will not make it worse. He walks 30 minutes a day. He checks blood pressure at home. He reduces sodium. He improves sleep. He practices 5 minutes of slow breathing in the morning. He asks his doctor for cholesterol and blood sugar testing. He takes medication if needed. Same blood type, same family history, different future. That is the point. Blood type gives you a map. You still have to drive. Now, I want to speak directly to the person watching who is over 45 and feels confused by health advice. One video says, eat this. Another says, never eat that. One article says your blood type changes everything. Another says blood type means nothing. You start feeling lost. But here is the truth. Blood type is not everything. And blood type is not nothing. It is one piece of the puzzle. The basics are still more powerful. Know your body. Know your blood type. Know your blood pressure. Know your blood sugar. Know your cholesterol. Know your sleep pattern. Know your family history. Know your symptoms. Then use that information to make smarter choices. You do not need panic. You need precision. You do not need fear. You need a plan. Now let us finish with the single factor stronger than blood type. Consistency, not genetics, not motivation, not one supplement. Consistency, consistent movement, consistent sleep, consistent blood pressure control, consistent blood sugar control, consistent stress management, consistent food quality, consistent medical follow-up, consistent attention to symptoms. Your blood type may influence risk, but consistency influences outcome. That is the lever in your hand. So after this video, do not just comment your blood type and forget. Use it. If you are type O, protect your stomach and keep moving. If you are type A, protect your heart and manage stress. If you are type B, protect your metabolism and control inflammation. If you are type AB, protect your brain through vascular health and sleep. If you are Rh negative, make sure your medical team knows. And no matter your blood type, do the basics. Do not smoke. Control blood pressure. Control blood sugar. Move daily. Eat mostly real food. Sleep enough. Limit alcohol. Avoid long sitting. Treat symptoms early. Get regular checkups. That is how you turn biological information into protection. Now, I want you to do one thing. Write your blood type in the comments. Just your blood type. O positive, A negative, B positive, AB negative, whatever it is. Then write whether this profile matches anything you have experienced. Stomach problems, high stress, clotting issues, inflammation, memory concerns, rare blood type concerns. I read those patterns carefully because your comments help shape future videos. And if this video helped you understand your body in a more personal way, share it with someone over 45 who still thinks blood type is only for emergencies. They may not need another generic health tip. They may need a more personal roadmap. This video is for educational and informational purposes only. It is not personal medical advice and does not replace your doctor, hematologist, cardiologist, neurologist, gastroenterologist, obstetrician, pharmacist, or healthcare team. Blood type may be associated with certain risks in population studies, but your personal risk depends on your full medical history, lifestyle, family history, medications, labs, and clinical evaluation. Always speak with a qualified healthcare professional before making medical decisions, changing medication, starting supplements, or interpreting symptoms. I am Dr. Adrian. Take care of your blood, take care of your heart, take care of your brain. And remember this, your blood type is not your fate. It is a clue. Use it wisely.